Good morning, people. YouTube family, it's Ambitious Abe, aka AmB. Back at it with another one. In this video, I'm gonna show y'all what life in pediatrics, hematology, and oncology looks like. It's Saturday morning. It's like 50 degrees, which is too cold in Texas, you feel me? But headed to the hospital. This is really one of the first rotations where I had to work weekends, so I knew it was coming one day, and internal medicine and surgery, I'm gonna have to work weekends all the time, so I might as well just get used to it. But let's get this show on the road.
Oh, Monroe. I need that thing there up there, come on. Just want to show you the sunrise, show you a little view. You know what I'm saying? It's pretty as hell outside. Woo!
So this is the inpatient floor. Basically, all of these are patient rooms that our patients sit in. This is our workroom. I don't know what this is for. I guess at some point in life they used to look at slides or something like that. I don't know. Alright, so boom, just rounded on our patients. So essentially what we do on inpatient heme-onc, you go in the morning, see your patient, see how they did overnight, all that, see if there's any complaints. And then from there, you round with your resident, and then you go start your note, and then your attending comes in, you round with your attending again. And then you and the whole team go see the patient together. And after that, everybody goes back to the room, puts their orders in, and starts to plan for the day. So in pediatric heme-onc, it's crazy, man. The patients, kids are cute as hell, you know what I mean? And it just warms your heart every time you see it. But at the same time, it can be emotionally taxing when you see, a child with, blood cancer, brain cancer, you know what I'm saying? And that kind of hit me hard when I first saw, there's a 7-year-old child with a tumor in his brain, and his prognosis wasn't good. And it's just, you just take a step back and just really take things at face value, just, what other people have to deal with. To that same note, though, I did want to mention, I think one of the beautiful things, and honestly, this is a beautiful thing about medicine in general, when you see somebody, I remember I came in on Monday and there was a patient that really wasn't doing well, kind of lethargic, not really responding. And by the time we seen her again on Thursday, seeing her every day, she was just a whole new person, you know what I mean? She was playing with her mom, playing with her phone, just happy, and it makes you happy, you feel me, when you're able to help somebody and do good and, see somebody become better. And it really, I will say this rotation honestly has, because my family medicine rotation, it was just monotonous, day in, day out, clinic. And I was just, all right, let's get this over with. But just the reason why you want to be a doctor, the reason why you want to go into medicine, I'm definitely getting that experience again, and I'm really having a good time so far.
How's it going? I'm Kelvin Monroe, Peds intern here at UT San Antonio Health Science Center.
Hello, show them the kicks.
Oh man, we got the kicks.
Bam.
Oh, no.
Okay.
But nevertheless, intern here. I'm on my Peds heme-onc rotation right now. It's actually my last day of the rotation. But this rotation has actually been very interesting because it started out my first week. I'm here and with the second year resident as well. She had clinic on the Thursday of that week, and I was by myself as an intern, which is fine. I got it handled, and also too, I got backup if I need it. I can call upper residents. But that morning, one of our patients, we knew he was gonna pass away, but we didn't expect him to pass away that quick. He started having some increased work of breathing and things. He ended up passing away that morning prior to rounds. I didn't expect that to happen. Straight up. It was hard, bro. I'm going about my day, all right, I got this, Kelvin, we getting our numbers and vitals and everything for the morning. I get a call yo, you need to go check on this patient. Go up there, increased work of breathing. like he's not doing well. You know, we're doing all the oxygen we can.
Yeah.
So I'm having to contact fellows and attendings, and I'm just getting on the rotation.
Yeah.
Still intern, my 5th month of residency.
How did you like cope and handle all those emotions?
It's a good question, man. So he passed away, say like 9:27. Straight up he did. In the morning. We round usually at 9.
Yeah.
But we were in his room when he passed away, you know, with the family. His mom, she hugged me. She was like, I know we just met and you just started taking care of him, but I really appreciate you taking care of him. And quite frankly, I joke around a lot and I say like, oh man, the allergies are strong, bro. Like,
yeah.
But hey man, I was tearing, I was crying. And then I walked out the room and like automatically I'm like, yo, let me grab my computer and let's round. And then the attending's like, hey man, you can take your time, you know, you're good. I'm like, nah, I'm ready to go. Just cause I'm so used to, I guess, just holding back my emotions in a sense and not showing my emotions. That's a whole nother conversation, right? But nevertheless, I knew I needed to cope with it. Yeah. And so we literally went down the hall from where this patient just passed away. He's still in the room, you know, down the hall, and now I'm presenting on another patient and you know, and talking about him. And in my head, I'm like, man, like, I feel a little foggy, you know? I feel like, I know there's like, my head is like, it's pressure in my head because like, I wanted to cry, but I really didn't cry. Yeah. And now I'm like trying to go on about a normal day. Yeah. And it was tough. It was tough. Yeah.
So, Dr. Monroe, why pediatrics? Why do you choose pediatrics as a specialty?
So, really, K-Mo love the kids. Nah, I really do. I enjoy working with the kids, whether it's sports, whether it's tutoring, and like from high school. I remember high school, I got a paid tutoring job for tutoring this kid in math. Mm-hmm. My boss's son. Yeah. And from then, I just kept tutoring and kept mentoring. And then at UT, I was a big part of the mentoring program there, going to the local elementaries. In the U-Teach program, shout out to U-Teach, I know they're doing big things now. At UT, and also I just love teaching and love just being around learners and young minds. Okay. And I have a very like playful young spirit, you know? Yes, sir. I knew it was for me, so.
So, Dr. Monroe, do you have any advice for medical students or pre-med students that are currently going through it, maybe watching this video? Anything you wish you would have known as you went through the ranks?
Man, where do I start, bro? But nevertheless, I think the biggest piece of advice I would tell anybody is perseverance really pays off. Yeah. I remember sitting at UT in a health professions counselor office, I think my sophomore year, and they're like, bro, you're not gonna become a doctor, not with these grades. Like, this is horrible. Like, they didn't say horrible, of course, but they essentially like, you need to look at new career paths. Mm-hmm. But I always knew I wanted to be a doctor. I didn't start off UT too well, my grades, but I always knew I wanted to be a doctor. And I really laced up my boots, strapped up, and got to work. And I was fortunate enough to have interaction with another advisor who encouraged me, hey, yeah, it don't look too good, but I know you can still do it. And honestly, that little piece of encouragement I got from that advisor like propelled me through biochem, through OChem, through everything else, and now I am here today. Yes, you know, sir. So.
Well, thank you for sharing your story, talking to the.
So, Dr. Monroe, really cool cat, man. It's a blessing when you get to work with, you know, individuals that one look like you, two just make the learning experience a lot more easier. You know, like the culture of medicine is really changing where like the malignancy is starting to like slowly fade away. The culture of medicine is really starting to change where, you know what I mean? Like everyone wants to help and everyone more than likely wants to see you get better. And it's, you know, it's really nice when you get to work with people that, you know, just make like coming in on a Saturday fun, makes it like don't even feel like work. I'm about to get off for the day. Today's Saturday. Head to the library for a couple hours. You know, I gotta eat my damn pancakes a bit. You feel me? Every day, small by small. Rockets play tonight. You know what I'm saying? So put in work until then, and then, you know, get a little schmig, get a little drizz Saturday night. Enjoy my night. Got tomorrow off. But I did want to say a big shout out to everybody again for, you know, messing with your boy. I think I'm at 3,000 subscribers now, which is crazy. pretty crazy, you know what I mean? But I appreciate the love, appreciate the support, all the kind words, everybody that says I've motivated them. Like, it's a good feeling, man, the fact that I'm able to help somebody go through whatever stage they are, wherever stage they are, you feel me? That's that, Pediatrics Hematology and Oncology. Your boy Ambitious Abe, aka AmB. Go ahead and subscribe, share, like, all that good jazz. Until next time, you know what's going down. Stay humble, stay hungry. Let's get it.